Hi everyone, my name is Dr. David Kulla. For most of you know me and follow the channel. And if you don't follow the channel, you should follow us. We have 4 great videos out every week, 16 give or take a month, and they're all videos to help people. It's not just hiatal hernia and costochondritis, but we do a lot of other videos, health related videos. This video, Sheree was so kind to do this. She came in to see me for hiatal hernia originally, and she's only had 1 visit, by the way. But she came in and she said she was really afraid to get adjusted. And this video is for people that are afraid of chiropractic, afraid to get adjusted. And I asked her, a fair question. I said, well, she said something to me today when she came in, which was interesting, that she said, I said, how are you doing? How'd you feel after your first visit? And she said, well, I don't see a huge change with my hiatal hernia. Okay, let's be honest. That's what this whole channel is, real patients, real testimonials, real people, okay? So, and then she said, but I noticed my back. Go ahead.
I noticed an improvement in my lower back after the adjustment.
Yeah, and she also said to me, she's like, I didn't know I had a back problem. I didn't really have back pain. So a lot of people, we all have spines, right? And chiropractic is not just for if you have back pain or neck pain. It's for people with spines and joints, which is all of us, right? I personally don't know how I would live without a chiropractor. I've been going since I was 14. I had scoliosis. I get it. I had back pain. Totally different story here. But, she was afraid. And I asked her why. If you've never been to a chiropractor, why are you afraid of chiropractic?
The stories on the internet about like the cracking and something going wrong, just that.
Yeah, so I guess the internet, she said, and that's understandable. There are going to be people on the internet, like I'm in some groups, like a spinal stenosis group. There's people that are like, no, don't go to a chiropractor. My doctor told me never to go to a chiropractor. First of all, if a doctor tells you not to go to another practitioner, and there's the possibility, even a remote possibility, that practitioner or that field of medicine or healthcare can help you, then shame on that doctor. Egos are not what this is about. This is about getting the patient well. So if a doctor badmouths another profession, then you should question that. You should wonder, whoa, wait a minute here. You should question it. I'm sorry. So for all of those people in these Facebook groups that have stenosis and back pain and problems, question that, okay? There are also many different techniques and many different chiropractors. Have you ever been to a dentist and had a bad experience at the dentist? Have you? No, you have. Okay, you've had great dentists. Okay. Well, for those of you that are out there, I know there's millions out there that would say, yeah, I've had a bad experience. You don't stop going to the dentist, do you? No. And then also, people on the internet, maybe they went in when they had a lot of pain in the first place. So maybe it didn't get better, or maybe it got worse a little bit before it got better, or maybe they only went once or twice and they didn't follow through, and then they're telling you a week later it was hurting. Yeah. It just, everybody's case is different. Each situation is really different, but all I can tell you this, if you're afraid, don't be. She was afraid of the cracking. So when I asked her last time, okay, you're afraid of the cracking. So there's a lot of techniques that don't require any cracking. So speak to the chiropractor. Understand that you don't have to have your joints cracked. There's so many different techniques and things out there, over 100, by the way. And several of them don't require any cracking, or there's just a lot of gentle techniques. That's why we chiropractors see infants. Yeah, babies, infants. Yep, weeks old. All the way up to seniors in their 90s. We have them here. We have children here too. So, we don't adjust everybody the same way. If we did that, then, man, we would never get results. Everybody's different. The human body is the same, but different, that saying. So I just want to assure all of you that there's nothing to worry about. And if you don't have back pain, that doesn't mean you don't need to see a chiropractor. Let me ask you this. Did you have back stiffness?
I think so.
See, she didn't even really notice that, right? But she noticed she felt a lot better after 1 adjustment. So we may or may not adjust her. She said she's open to it now. We're going to stick with the non-cracking techniques, gentler techniques, okay? So there you go, folks. Will you let people watch the adjustment I give you?
I'm shy.
Okay, she's shy. But I have other other videos on that. Check out my Thompson technique. That's a really gentle technique. Activator is another technique. Network chiropractic is super gentle. I don't know about that. I'm not a big fan of that. But activator and Thompson technique. There's other soft tissue techniques. Cox flexion distraction technique, really gentle for disc herniations and post and pre-surgical cases. Thanks for tuning in, folks. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.